I'm over the age of 18 and I consent to this head-to-toe assessment video. Yellow.
Hi, my name is Michelle. I'm going to be your nurse today.
No.
So I'm going to do a quick head-to-toe assessment, and it should take me about 15 minutes. Is there anything you need before I begin? Do you need the bathroom? Do you need any water?
All is good.
Okay. All right. So can you tell me your first and last name?
Tyler Roach.
All right. And do you have any allergies, like to latex, shellfish, environmental, or any medication allergies?
Nope.
All right. And I'm going to ask your pain level. So are you in any pain at all?
Nope.
So on a level from 0, starting from 0 to 10, 0 being no pain, 10 being the worst pain, can you rate your pain for me?
0.
All right, perfect. So I'm going to start with your general appearance. You look clean, you look dry, your skin is appropriate to your genetic background. It is warm to touch. Like I said, it was dry. Your facial features are proportionate, and you have no signs of acute distress. So now I'm going to assess your body structure. Okay, so you are in an erect posture, and your body is symmetric, and you have no physical deformities that I can see, and your behavior is also appropriate to this situation. So now I'm going to assess your level of consciousness. So I'm going to ask you 4 questions, and just answer them to the best of your ability. So what's your name?
Tyler.
All right, and where are we?
Our house.
All right, and what time is it?
12:35.
All right, and what are we doing today?
Head-to-toe assessment.
All right, so you are alert and oriented times 4 to person, place, time, and event. So now I'm going to go ahead and assess your vitals. Assessing vitals, and blood pressure was 120/80. And then now I'm going to take your pulse for 1 minute. Alright, and your pulse was 72. So I also assessed your respirations, and they were 18. And took your temperature, and it was 98.6. And you are 100% O2 on room air. So now I'm going to assess your skin, okay? So your skin is warm, it is dry, you have pink undertones. So now I'm going to assess your skin turgor. So your skin turgor is elastic, and you have no tenting. I also noticed that you don't have any rashes or any lesions or wounds that I can see. You do have a tattoo on your right upper arm. Alright, so now I'm going to assess your nails. So can I have your nails? Alright, so your nails are uniform in color and in shape. Your capillary refill is less than 3 seconds, and you have no clubbing. Alright, so now I'm going to assess your head. So your head looks normocephalic. I'm going to go ahead and palpate it, okay? So I don't feel any bumps or wounds or lesions, and I don't see any infestations. Alright, so now I'm going to assess your face. So your face is symmetric. It is appropriate to your body, and your facial expression is appropriate to the situation. So now I'm going to assess your lymph nodes, okay? Alright, so I'm just going to palpate them. So I'm going to palpate your periauricle, postauricle, submental, submandibular, jugulogastric, and I don't notice any nodules. So your neck is symmetric, and your trachea is midline. I didn't feel any masses upon palpation. Alright, so now we're going to move on to your eyes. So I noticed that you wear glasses. Do you wear your glasses all the time?
Yep.
Alright. So can you take them off for me, please?
Sure.
So I noticed that your eyes are symmetric. I don't notice any drainage or any lesions on them. So I'm going to check your conjunctiva is pink and moist, and your sclera is white, which is good. Your eyelashes are full, and your eyebrows are full, and they're evenly distributed. So now I'm going to assess something called perla. So I'm going to get my pen light. Alright, so just look at me. Alright, perfect. So your pupils are equal round and they accommodate to the light. And they react to light and they also accommodate. Okay, and there's no nystagmus, which is great. Alright, so now that we're done assessing your eyes, I'm going to assess your ears. So your external ears are proportionate to your face, and they're symmetric. Your external auditory hiatus has no lesions or wounds that I can see, any tenderness, and there's no drainage. So I'm going to assess the back of your ears for any skin breakdown. Okay, and there is no skin breakdown upon your ears. Are you exposed to any environmental noise?
No.
No? Okay, perfect. And how do you clean your ears?
Q-tips.
Okay, so we shouldn't be cleaning with Q-tips, we should just be using tissue. So now that we're done assessing your ears, I'm going to go ahead and assess your nose.
Okay.
So your nose is proportionate to your face. The external structure is symmetric. So I'm going to assess your patency, okay? So can you cover one nostril for me and inhale? Okay. And the other one. Okay, so your nostrils are patent bilaterally. So now I'm going to check your septum, and it is non-deviated, and I don't see any drainage, which is great. So now that we're done assessing your nose, I'm going to assess your mouth. So your lips are pink. They are moist. I don't see any cracking or any lesions. Can you open your mouth for me? Your oral mucosa is pink and moist also, and so is your buccal mucosa. Your teeth are straight and intact, and I don't see any lesions in there, which is great. So I'm going to also assess your uvula. So can you say ah for me?
Ah.
Alright, and your uvula rises when you say ah, and then can you swallow for me? Perfect. Alright, so now I'm going to move on to your respiratory system. So I see that you did not use any accessory muscles when you were breathing. And your chest rises upon inhalation and then it depresses under exhalation, which is great. So I'm going to go ahead and auscultate your lung sounds, okay?
Okay.
Alright, so I'm going to go ahead and start with your right upper lobe. And you can inhale and exhale. And left upper lobe. Good. Inhale. Okay. And lower right lobe and lower left lobe. Alright, so I'm going to do it posteriorly so you can just stay where you're seated. Okay, inhale, exhale, inhale, exhale, inhale, inhale, and one more time. Alright, so your lungs are clear in all fields, which is great. So now I'm going to move on to your cardiovascular system. So I see that you have no jugular vein distension. Okay, so I'm going to go ahead and listen to your carotid arteries with my diaphragm of my stethoscope. Good. Okay, and I'm going to go ahead and palpate them, okay? And they're in sinus rhythm. I heard S1, S2. Okay. Alright, and your pulses are strong. I would say they are 2+. Alright, so, and like I said, your chest was symmetrical, and so now I'm going to go ahead and listen to your heart sounds, okay? So I'm going to start with your aortic valve. Good. Alright, your pulmonary valve. Your herbs. Good. Tricuspid. And I'm going to listen to your mitral valve for 1 minute, okay? Okay, and I got an apical pulse of 72. All right, and we listened to your apical valve at the 5th intercostal space. All right, so now I'm gonna assess your GI system. So if you could lay back for me. All right, perfect. So your contour is flat. Like we said earlier, your skin is warm, dry with pink undertones. So I'm gonna go ahead and listen to your bowel sounds. Okay.
Okay.
Okay, I'm starting at your right lower quadrant. Good. 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 All right, and your bowel sounds are present in all 4 quadrants, and I also didn't see much or any pulsations. So I'm gonna go ahead and palpate. Okay.
Okay.
So I'm gonna start at the right lower quadrant again, and you tell me if you feel any tenderness. So I feel no lumps, no nodules, no masses. So any pain upon palpation?
No.
Alright, and I also noticed that you didn't guard or you didn't have any rigidity. Okay, so now we're going to move on to your muscular system, okay? So I'm going to have you sit up again. Can you touch your right arm to your left shoulder for me? And then can you do your left arm to your right? Yeah, perfect. Alright. So now we're gonna go ahead and I'm gonna see. So your contour and your muscles are appropriate for your stature. So I'm gonna go ahead and palpate your joints. Okay. So you tell me if you feel any tenderness.
Okay.
Any tenderness at all?
Nope.
Any tenderness by your calf?
No.
Okay, so your calves are warm and they are dry, and I don't see any redness, and no pain on your calf, you said, right?
No.
Alright, perfect. So now I'm going to test your muscle strength. So if you could put your arms out for me, and then try to push your arms towards you. Perfect. And on the other side. Perfect. And I'm do the same thing to your legs, okay?
Okay.
Alright, try to push your legs back. Good. And another one. Back. Okay, and while we're here, I'm going to listen to your dorsal pedal pulses. So if you could put your feet out. Alright, and they are 2+ bilaterally. Alright, so now that we've done that, oh, and I'm going to test your shoulder strength too. So if you could shrug your shoulders for me. Alright, perfect. So now I'm going to move on to your cranial nerves. So we are going to start with your olfactory nerve. So that's your first cranial nerve. So this is your sense of smell. So can you close one of your nostrils and then smell this for me? What do you smell?
Coffee.
All right. And the other side?
More coffee.
All right. Good. So cranial nerve number 1 is intact. So now next we're going to do the optic nerve. So in front of me I have the Snellen chart.
Okay.
So without your glasses, can you read the first line for me?
Nope.
No. Okay, and then can you put your glasses on and read the first line for me, please?
A, B, C, D.
Perfect. Okay, so your optic nerve is intact when you have your glasses on. So now we're going to assess cranial nerves 3, 4, and 6, which is your oculomotor, your trochlear, and your abducens nerve. So we did that when we did the perla. But I'm also going to do something called the gaze, the 4 gazes. Okay, so take a look at my pen and just follow it for me. Perfect, so that is intact. So now I'm going to assess cranial nerve number 5, which is your trigeminal nerve. So if you could close your eyes for me. Alright. And just tell me what you feel.
My cheek.
Okay.
My other cheek.
Alright. Alright, so that was cranial nerve number 5. That was your trigeminal nerve, and it was intact. So now we're going to do your facial nerve. So can you smile for me? Can you puff out your cheeks for me and scrunch your eyebrows? Alright, good. So your face was symmetrical and there was no drooping. Alright, so now we're going to assess your vestibular cochlear nerve. So we're going to do something called the whisper test.
Okay.
So can you cover one of your ears for me? I'm going to whisper something for you and just tell me what you hear, okay?
Mm-hmm. Pizza.
Okay, and now your other ear?
Juice.
Alright, great. So that was your 8th cranial nerve, and that was intact. Okay, so now we are going to assess cranial nerves 9 and 10. So this is your glossopharyngeal and your vagus nerve. So can you go ahead and, we assessed this earlier, can you go ahead and say ah for me?
Ah.
Okay, and again, and your uvula moved and was midline. And then can you swallow for me? Perfect. So cranial nerves 9 and 10 are intact. So now we're going to move on to your spinal accessory nerve. So I'm going to place my hand on your cheek and you're just going to go towards my hand, okay? Perfect. And the other side. Perfect. So spinal accessory nerve. Oh, let's do the shoulder shrug again too. Alright, perfect. And that cranial nerve number 11 is intact. So now we're going to do cranial nerve number 12. So this is your hypoglossal nerve. So can you stick out your tongue for me? Move it up and down. Perfect. Alright, cranial nerve number 12 is intact. Alright, so we're also going to do some sensory nerves. So can you close your eyes for me and just tell me where you feel this?
A leg. Shoulder. Cheek.
Perfect. Alright, and now we're also going to do your motor nerve. So if you could stand up for me. So we're going to do something called the Romberg test. Okay, so can you close your eyes for me? Alright, and then we'll do this for 30 seconds. Alright, perfect. So you get a little bit of swing, but your balance is intact. So you can go ahead and sit down. So I'm also going to do some rapid alternating movements. So can you touch your nose? Can you touch your chin? Can you touch your shoulder? Can you touch your knee? Perfect. Alright, so that's all intact. So that completes my assessment. So I'm going to reassess your pain. So on a scale from 0 to 10, 0 being no pain, 10 being the worst pain ever, can you reassess your pain for me, please?
0.
Perfect. So do you need anything before I leave? Do you need a blanket or water?
Nope, all's good.
Alright, so thank you again for letting me assess you, and the doctor will be in soon.
Sounds good. Bye-bye.
Alright, thank you.